This is Erin Coop again at JBI. This podcast is on smoking cessation interventions and strategies. This best practice information sheet is based on 12 new and updated systematic reviews and is Volume 12, Issue 8, 2008. Background. This information sheet provides more conclusive evidence about effective smoking cessation, including both NRT, nicotine replacement therapy, and other strategies, or as we'll call them, interventions. NRT forms the mainstay of smoking cessation strategies. However, there is a lot of evidence concerning a broad range of other interventions. These range from behaviour therapy to counselling, self-help strategies, and other pharamacotherapeutic interventions. Initially, health professionals can help stimulate awareness. Individuals can then be referred either to a specialist or to a service. Objectives and types of intervention. The purpose of this best practice podcast is to describe the best interventions for smoking cessation. The strategies documented consist of therapeutic strategies, for example, self-help or group-oriented, and medications derived from pharmacotherapeutic sources. Findings. The findings are categorized based on types of interventions. Important findings for therapeutic strategies relate to self-help, individual therapy, group therapy, aversion therapy, and alternative therapies interventions. Important findings for pharmacotherapeutic sources relate to NRT, NRT gum, NRT patch, opioid antagonists, and antidepressants. Findings are also classified according to specific patient populations, which include hospitalized patients, preoperative patients, and coronary heart disease patients. Recommendations. These recommendations are based on strong evidence that merit application in clinical practice. Self-help should not be considered a frontline smoking cessation therapy. Group therapy programs can be offered before self-help programs and can be added to NRT. NRT patches, when worn during waking hours, 16 hours a day, for up to 8 weeks, have a therapeutic effect. In individual cases where NRT has not been effective, consider a course of bupropion or nortriptyline. Among hospitalized patients, continue intensive counseling for up to 1 month post-discharge. All patients who use tobacco should be offered advice on smoking cessation by their physician, pharmacist, or nurse. Well, that's all for this episode. We'd love to hear your feedback on this podcast. Thanks for tuning in.